Morning, everyone. We're glad you can join us this Friday morning at the end of September. Hopefully, it's a pretty day wherever you are in our state. I'm Tara Bell. I work with Smoke Free SC. Barbara, our executive director, is usually the one who does the introductions and the welcomes, but she's just having a terrible time in beautiful Maine right now.
Uh,
Yes. So she is having a great day. She sent me some pretty pictures. So she's living her best life in Maine, but she does miss all of us and wish us well. We're excited y'all are here today. We have Kellie Lamb from the American Cancer Society as our main speaker today. But before we get into Kellie, Beth Johnson from American Cancer Society Cancer Action Network is going to give us updates from her end. So I will pass it to Beth.
All right. Well, good morning, everyone, and happy Friday. I'm glad I could join y'all. I feel like I'm always joining from the car or somewhere. So today I get to see everybody and see who's on the call. So good to see you. Not much of a legislative update, honestly. The General Assembly is not meeting right now. It's not during session. However, I think the Senate is scheduled to meet to pick up a few bills not related to anything to tobacco at this point. But we are preparing for a January session start date. And in that preparation, I wanted just to share that we are still in conversation with our friends at CDC and also with our friends at DPH. We are hopeful that DPH will receive some CDC funding. We all know that the federal funds from the Office of Smoking and Health through the CDC that previously came to our state. It was $1.7 million that those funds were cut earlier in the year. However, the DPH Tobacco Division did apply for CDC funding, and I just put a call in yesterday to DPH. I don't know if they have received any funds yet or how much those funds are, and um, it's still kind of a holding pattern. So don't know what that's looking like. Don't know if they have received funds, but I've made the request to ask to see if we know if we have any of those funds that have come through. What I can say is that other states have started receiving some of the funding. So we've heard from friends in other Louisiana who've received funds. North Carolina did not receive funds. Georgia didn't apply for the additional funding. So it really varies by state, and we're just hopeful that South Carolina has received some of the funds. If not, then I think the obvious point is that there will have to be some programs cut, and we don't know what that's going to look like yet. The other thing I just wanted to bring to everyone's attention is that while we are uncertain about the funding from the federal government, our ask still remains that we want the entire JUL funding. I call it JUL funding, but it is funding that South Carolina receives from the JUL lawsuit in which South Carolina was engaged. That funding that continues to come to the state, that is currently going into the general fund for the state, and they use that for however they want to in different pockets. In other states, that money has been allocated for tobacco prevention and control, but not in South Carolina. So we continue to make that a priority ask for us. That is a legislative ask. We made that ask last year. We were not successful, but we will make that ask again in January. And that ask for this year will likely be around that 1.7, $1.8 million mark. So South Carolina has been receiving the funds from the JUL lawsuit for about 3.5 years now, and they'll receive another payment in December of this year. And that payment for this year, each year it varies, but the payment for this year will be around 1.6, 1.7 million. So we will ask the legislature to allocate those funds to tobacco prevention and control instead of the general fund. So that's one of the things that we're working on, and I wanted just to make this group aware of. The other thing, and I think Barbara had mentioned this to Smoke Free SC board members and possibly to others, the Children's Committee, which is a committee of citizens and legislators. They are meeting, and they will continue meeting for the end of September and October. They meet in different locations all around the state. They try to hit all the different geographical areas. So they're meeting, and that's a great opportunity that if you see them in your community, to go and tell them about the work that you're doing. Tell them about the tobacco work that you're doing, especially if it impacts children and youth. They love to hear from the public. It's open to the public. All you have to do is register. It's a really simple process, and I think Tara and Barbara can help you with that process and share that information. But please feel free to go and just to tell them what you're doing, and continue to talk about the issues, because what we don't want to happen is, because DPH possibly, well, they lost funding, but if they don't receive any additional funds and they don't gain that funding back, we don't want those programs to just go by the wayside, and we want to continue. We're going to be relying more so than ever on our community partners to pick up the work. So happy to take any questions, but short update. Um, Lots of planning and strategy going on now as we try to prepare for January session.
Thank you, Beth.
Yeah.
Does anyone have any questions for Beth?
Well, Beth, can you just update us on any, tobacco products taxation?
Mhm.
Any,
Yeah.
I've had a couple of my local officials, say, why aren't we taxing vape liquid? Any comments?
Yeah, so the taxation of products can be really tricky because of the way the products are defined in our current law. And this past session, there was um, a bill to uh, to differentiate the tax on IQOS, the newer product, the smokeless, or yes, it's
Burned,
right, not
heated,
burned,
heated,
heated,
heated.
not burned
Yeah,
tobacco products, right?
yeah,
So the the whole taxation of each of the products can be very tricky because of the definition that we currently have in our state law. And there has been some move to change the definitions. For example, the one for IQOS, the heat not burn product. The liquid product, I think, again, can be tricky. I think from ACS Can's perspective, we're open to looking at a possibility of a tax, but if we open that conversation, then we want to go in with the question, or not with the question, but with the stance of taxing all products at parity. If we
yeah.
start picking and choosing, then we'll end up losing. So I think our friends in North Carolina are at the point where they might look at a tax. Our friends in Georgia might look at a tax next year to kind of offset some budget needs for their state.
Yeah.
So I think it's definitely a conversation that we can start having, is whether the timing is right for South Carolina. But if we do that, it's really in our best interest that we look at tax across the board for all products at the same time.
All right.
Yeah.
Thanks. That's
Yeah.
helpful. Yeah.
The IQOS bill will be one that we do not support that, and so we will try to fight back on that bill as we go into January session. It stalled last year, but and what I could do, Tara, is maybe November, or we don't have a call in December, right? So
Yeah,
maybe
we don't have one
November.
November or December because they
Okay,
both
so
fall during holiday weeks.
perfect. All right, so January 1st to January 1st call, I'll give everybody an update with new bill numbers
Great.
so that we can be prepared for those bills, because there's probably, I know right off the top of my head, there are 4 bills that we will oppose going into the new January session. All related to tobacco, taxation of the product, distribution of the product, how even some definitions that would hurt us later on if we worked on a tax.
All right.
Yeah, that'd be great for January.
Yeah.
Well, thank you, Beth. I shared information about the Children's Committee
Perfect.
in the chat with the dates and the information and the email you would need to email if you're interested in speaking one of those or during one of those. If you need help with preparation or questions, you can reach out to us, and we'll loop Beth in as well for that conversation. But all of that, those details are in the chat. So if you're interested in that, just let us know.
Yeah.
So now I'll pass it over to Kellie Lamb from the American Cancer Society, who is our speaker today, and we're so happy that she's able to join us.
Yeah, thank you guys for having me. Yeah, always good to hear from Beth. And the policy side, what I'm going to talk about today, and again, ACS, and I am a senior program manager and work on tobacco control. There's three of us that cover 13 states. And these are the tobacco nation states. I think South Carolina has done really well in lowering their tobacco use rate, where they're not really considered a tobacco nation state, but there's still policies that are highly important to help protect people from the dangers of obviously secondhand smoke and reduce tobacco use even more, and of course, decrease lung cancer mortality. So, I have been doing tobacco work for about 15 to 16 years. I have worked locally, mostly in Mississippi, just to give some background from it. And also, this is always from an educational standpoint. I've never been allowed to do, kind of policy work with Beth does and advocate to council members or ask for votes from legislators. So all my work is educational. So I thought it'd be great to just kind of share how this can be done on working on a smoke-free policy and then the importance of tying in tobacco cessation within that work. So we'll go ahead and get started. We'll go to the next slide. Thank you, Tara, for doing my slides for me. I like to look at my notes. So does anybody know how much commercial tobacco use is a leading preventable cause of cancer occurrences and death in the US? About what % of cancer deaths are caused by smoking? Does anybody know? Take a wild guess.
Or maybe 60%. I don't know.
I would say about 20%.
We're kind of between the high and the low. It's 36%. So if you want to hit it again, Tara, it should pop up. Tobacco still is considered the most, it can be the most preventable cause of death and cancer. So it does lead to more cancer deaths than any other kind of substance. So that's still a high percentage, right? So this is why it's just so important that we still focus on tobacco. I know there's a lot of other kind of cooler things to talk about. We talk about food, of course, alcohol now, but tobacco still is the leading cause of cancer deaths. Next slide. So every
Kelly,
year,
Kelly,
sorry.
yeah. Does that include deaths from secondhand tobacco exposure?
I don't know that they've included that. I think this is just
Okay.
from even use.
Okay, because I was thinking breast cancer with um, indoor workers and
Right.
cancer deaths that way. Yeah. Okay.
Yeah. I
Yeah.
think this is more considered just the actual tobacco use.
Okay.
But on this slide, you'll see how many people in South Carolina do die each year from tobacco use. And smoke-free laws can be a great way to encourage people to quit and protect people from tobacco. Hold on. Hey, I'm sorry. I'm in window room and my dog sees people walking by. My apologies. And so there's no safe level of tobacco smoke. And I may be preaching to the choir, but I definitely wanted just to reiterate these quick facts. The next slide as well, just to touch on what secondhand smoke is. I have preached this for years, but unfortunately, secondhand smoke, and this is from combustible tobacco or burning tobacco, contains more than 70 carcinogens. A lot of them are listed on here. I got this information from the Truth Initiative. So even if you don't smoke, breathing in secondhand smoke means you're inhaling these same toxic chemicals like benzene, formaldehyde, ammonium, many of which are known to be carcinogens. We know carcinogen means cancer causing. So there's no safe level of exposure. Some of us are born to the time where they had smoking and non-smoking sections. We know that doesn't work. We know that there's no filtration system that can clean the air. The groups that's over air conditioning and things like that have come out and said, hey, there's nothing that can take these toxic chemicals out of the air. And unfortunately, within 5 minutes of just breathing secondhand smoke, your arteries begin to stiffen. And I know that I'm not exposed too often anymore, but when I do, my hometown has casinos and we still attend events there. We've gone to dinner there. But I can feel the changes that happen in my body now. I'm more aware of them, whether it be a headache, dry mouth, watery eyes. And of course, that smell kind of lingers even when you leave an area that had smoking. So if you're ever around it again, too, just something to think about, pay attention to how your body's being exposed and what that feels like. Within 20 to 30 minutes, blood starts to clot, and increasing your heart attack risk. And within 2 hours, there's an irregular heartbeat, and that can be the length of a meal, you know. So it's just something to think about whenever you're around anyone that's smoking, or if you're inside a place that allows smoking. So just kind of wanted to highlight that. Next slide. And then these are just some of the stats around South Carolina facts. These were pulled from the the state of tobacco, for each state that the American Lung Association actually puts out every year. And then just some national rates. So you can see that South Carolina is very close to the national rate of smoking rates. And then just what still the popular use is. I wanted to highlight. Of course, we have seen it fall dramatically for adults and youth over the years. I think a lot of great work has been done because of advocating and educating in communities, right? It goes back to the basics of people doing community work, reaching youth, reaching adults, and being in the communities that we've said had such a great impact. I know I was a part of that in some of my early work. Unfortunately, to have e-cigarettes show up on the scene and kind of pull back a lot of the work that we had done. But we see those numbers drop still a little bit, but it's still there, and tobacco industry is finding ways to weasel their way into young people's lungs. Next slide. So just a quick history. Obviously, I am not a South Carolina born native, so I had to do a little research on, the history of kind of smoke-free work within the state. In 2008, there was a landmark decision. The South Carolina Supreme Court everyone ruled, sorry, that local governments have the authority to enact and enforce smoke-free laws. So this inspired and empowered different municipalities to take their independent action to protect public health. And so since 2008, nearly 71 communities across South Carolina have adopted a strong smoke-free ordinance. I'm very proud to say I live in Lancaster County, which is completely smoke-free. All the cities and the county is entirely smoke-free. I did not plan it that way. I just got lucky and ended up here. So I feel like that's something to be proud of. Does anybody know, and this is kind of a trick question, but does anybody know which community was the first to pass a smoke-free policy in South Carolina?
When it down on the coast, South Sullivan's Island.
It is. Good job, Dr. Keeley. I had a feeling you may know. But this was done in June of 2006. So this was even before that landmark decision was made, to let communities, either decide if they want to have a smoke-free ordinance or not. So it was challenged, but it was upheld. And then Greenville rolled next in October of 2006. Again, challenged in the courts, but was able to be upheld. And then this landmark decision happened in 2008, and we've seen this work continue to grow over the years. But this still only protects 30 to 35% of people within South Carolina. So it's still a large part of the communities and people that are not protected from the dangers of secondhand smoke. So while this is amazing work, and I will share that the majority of states in the United States have a statewide smoke-free law. We are in the minority in South Carolina, and pretty much all the states I work in are not smoke-free as well. But this is not new. This is not anything that's that's revolutionary anymore. It's been done, and we'll talk more about what the effects of a smoke-free policy is and does it hurt business. Okay, next slide. So smoke-free South Carolina, I just wanted to share, the South Carolina Department of Public Health have developed model policies to help guide institutions and communities into implementing smoke-free work and environments. You can go on their website and pull these up. And it's not just about workplaces, but, well, I mean, like restaurants and bars, but it's also colleges, universities. You saw the sign here, we're tobacco free USC, healthcare facilities, which is so funny to go back now. I know I watched the movie Still Magnolias a couple months ago, and when they're in the hospital and somebody's lighting up and smoking in the hospital, it's just wild to me now, but it is still a thing, and there are facilities that don't have, smoke-free campuses. It might be smoke-free on the inside, but people can smoke right outside of the door going into a healthcare clinic. And then you have faith-based organizations, we have parks, work sites. So there's a lot of places that still need to be protected. So if you're looking to maybe educate or learn more about what you can do in your community, the Department of Public Health here in South Carolina have some great ordinances and guidances on that next step. And then finally, I just wanted to kind of present day of where we are in smoke free. The Air Preserve Group is doing some great work in some of these communities listed up top. I think there might have been one or two that might have been joining the call today, but I just kind of wanted to highlight, that there is work going on in communities. There are grants, but of course, with funding in tobacco, sadly, some of that might be lost over here in the next few months or years. So it's really going to take some of us local people within our own communities to speak up, talk to businesses, and continue to spread this message. And so what does the smoke-free, 100 smoke-free policy look like? I unfortunately have found that people in the community don't truly understand what it means. They think that you can't smoke anywhere in a city. Like it's, not even outside, nobody can smoke anymore. And that's not the case. So, but comprehensive does usually mean all indoor public places that are open to establishments, and those can be private businesses as well. Um, like, um, like a VFW and things like that. And then it usually includes, back in my early days, of course, it was just combustible tobacco. But now we've had to go back and incorporate e-cigarettes, hookah, marijuana, and other things that are on the rise. And just you want to make sure that this information is easily understood for the public and the businesses. And so keeping it clear and concise on what this means to have a 100% smoke-free policy. All right. So some strategies. So I just really kind of wanted to touch on what this means and how you can do this work locally, just even from an education side. Next slide. So South Carolina preemption status for local smoke-free policies. Does anybody know, are we preempted or not preempted in this state?
We're preempted.
We are not preempted. So that
Oh, for
means,
local.
yes, state law does not preempt local governments from adopting smoke-free air laws.
Oh, smoke free. Okay.
Sorry, there may be other preemptions, but for passing a smoke-free law locally, and so preemption just refers to the situation in which a law passed by a higher level of government takes precedent over laws passed by a lower one. And that's kind of what they decided in 2008, was that local municipalities, whether it be a city or a county, can decide on their own if they want to pass a smoke-free law. Again, I wasn't aware that states couldn't do that until really this job. And I do work in the state of Oklahoma, and they are not allowed to pass any smoke-free laws on the community or the local level. So that really is a plus for South Carolina. Preemptive state laws set a ceiling rather than a floor, and they do not allow local authorities to enact these strong local laws that could work for their community. So this is, again, a plus. So Tara, you might want to hit it one more time. And then we'll go ahead and go to the next slide. There we go. So this is a message really from ACS Cancer Action Network. This is something that we stand by as ACS itself, but everyone has the right to breathe clean, smoke-free air. ACS CAN does not support smoke-free laws that allow the separating of people who smoke from people who do not smoke, or ventilated buildings as an alternative requirement. 100% smoke-free environment. I mean, the evidence is just overwhelming that the measures cannot eliminate exposure to secondhand smoke. So the work has been to create 100% smoke-free environments as part of a comprehensive approach to reduce tobacco use and the exposure to secondhand smoke in South Carolina and across the United States. So next slide. Just to kick off a campaign, and just these are, again, some just simple guidelines. I will promote the Americans for Non-Smokers' Rights and their foundation. They have a lot of great information on there. This is where I've gauged some of that. They do a lot of smoke-free work across the United States and working with casinos, municipalities, and good guidance. But ACS CAN as well has been in this a long time. And these were just some steps. Every policy campaign or work should start with an assessment. You really should understand what is happening in the environment that you're focusing on. A strong coalition of supporters is also key, and able to access these supporters when important meetings, important events come up. So the heart of your campaign can be making sure that your community truly understands why this work is important and this policy change needs to happen. And a great sponsor, that's usually your champion, can be the catalyst for change. So next slide. So again, assessing the situation. Again, you can find things online that you can pull from. I'll have some of these resources at the end that can give you kind of an outline of how to assess your community. So the study finds that document levels of public awareness of the health effects of secondhand smoke, and this proposed policy and public support for smoke-free environments and for a smoke-free law. The findings can help determine whether you have enough support to move forward, or if more public education really is needed. In addition, the findings establish kind of a baseline to measure change. So who is protected and who isn't? Who is still allowing smoking to happen indoors? Are there any exceptions? Are there hotels that still allow smoking? Who is going to enforce this law and who would be responsible for passing it? And I found too, understanding your local municipality, how do they vote? Who gets a vote? That's done differently in different communities. So having just a general idea of how that takes place and what you need, what kind of vote you need to pass this is really key on how you move forward. And knowing these things will help you just throughout the process. And be prepared to just answer questions from allies, those who are pushing and those who are pushing against you. And then again, going back just to knowing how many votes you need and if the mayor has a vote as well. So next slide. So hitting the streets, and I think this is what a lot of local coalitions are really good at doing, are working with their communities and other civic organizations on doing the education. So just showing up in your community, sharing what a smoke-free policy is. Again, I think there can be confusion around that. I know that with just being in tobacco work for so long, I take it for granted how much I understand the impacts and the messaging and the wording. But for your average layperson who has not worked in public health, they may not understand. So just keeping it plain and simple language. Some ideas could be tailgating, health fairs, community festivals, just anywhere that you can grab a lot of people at one time. And then speaking to civic organizations like your Rotary clubs or chambers, at chamber events, just anywhere that you have business leaders and local community are just really great ways to engage, outreach and education. And then in finding stories, we'll get to that too. And this is a great way to find stories. I have always said when I worked in the field, whoever has used tobacco before and they have quit, they love sharing their story. We have found people who have been exposed to secondhand smoke, who have had health issues. They usually like to share their story. People want to share their story because it's affected their health, their wellness, and just even affected how, them quitting and how tough that was. So, it can be, if you just kind of put yourself out there and ask for it, it can be easy to find stories for people to share. All right, next slide. So just focusing too on your allies, making a list of who would be important. And these were just kind of some highlights of who we've used in the past. And it can range where you kind of get more buy-in and not, but use these groups and individuals as well to gather stories. Support this cause because of my family or how I was exposed to secondhand smoke. But again, having somebody from each of these groups can be key into making this change at the council, the city council, or the board level. And these can be great speakers when they do go up and educate a city councilor or board about why this is important. And then messaging the issue. Messaging is key. Potential allies and partners want to know, why should I care? So be prepared to talk about tough issues, keep the message broad to reach a lot of people, but specific enough to touch the community and what that community looks like. You know, you have pregnant moms, or is it a predominantly African American community? What works for your specific community? So I put a few on here. This can be hard to do, right? Because it can be very diverse, and how do you get to everyone? But it is possible. And again, just going back to the facts, and using those stories, how it's touched, you know, allies, and how it's touched their lives, can be very impactful. It can be tough to talk about this issue, um, and the hazards of smoke. You will get pushback, but if you get enough people and allies on your side, it can be easier to go up against some of the groups or organizations that might come out, to push against this. So talk about your smoke-free being a benefit to the community, to the economy. If smoke-free environments weren't good for businesses, you wouldn't see those policies being passed regularly across the nation for decades. Okay, next slide. So going back to what's your story? So, you know, do your allies have stories that they can share? Why is a business owner or church supporting this smoke-free policy? What have they seen from their customers? Maybe even share a story. We gathered those stories before of a business going smoke-free. I remember passing it at a city one time, and this is after, although I've shared this story, hopefully I haven't with you guys, but after all the Waffle Houses went smoke-free, back where I was, that's on every street corner was a Waffle House, and that was the place to go to have your coffee and smoke your cigarette. So for them to all go smoke free was a big thing. And so when we had open public comment before they went in on a vote in a city, the local Waffle House called and said, you know, we think you should do it. We see more business now than we ever saw before, because we are smoke free, because they weren't having those people come in that didn't want to be around secondhand smoke. So can you get those kind of stories from people who've maybe changed their policy at a local establishment, a bar, or a restaurant? And use these stories. Marion, right here in this picture, her husband was a police officer for years in a city that we've worked on smoke-free for a long time. And he never smoked a day in his life, but whenever he worked there at that police department, they allowed smoking indoors. And he ended up with throat cancer. And she's had to be a caregiver. While he is cancer-free now, he's had a lot of health issues that have come along with that. And just seen a lot of doctors, and just a lot of issues. And she's had to take care of him. And so she was nice, and she was great to share her story with us, and what that's meant to her, and why smoke free is important. So finding these people, sharing their stories through social media, through print, letters to the editor, can be very helpful in getting public support. All right, next slide. So think about who these groups are, your opposition. We know it sometimes can be bars, it can be current smokers. If there's a casino, it could be vape shops. We can't assume that they will be there, but we need to know how to deal with them if they do show up. Tobacco Free Kids has a great toolkit for opposition, and kind of pushing back. Tara, if you want to hit it again, there should be some things that populate. These were just some of the questions. So knowing who those oppositions are within your community. Is there a place that still allows smoking, and is it important to them? Are they willing to change? Sometimes you can go have these one-on-one conversations with them. We've had businesses in the past, I think it was Applebee's, that still allowed smoking in one of the communities, which is just crazy to me because they promote such a family-oriented restaurant. And from what we got from management talking to them, this isn't here in South Carolina, they didn't care. They were like, pass it. You know, we're not going to push against it. This is just something our company still does. So having these conversations and just figuring out who will be your opposition and who won't. It can be kind of scary, but if you go in there with just an education background, and that you're just doing this for, you know, the health of your community, you know, usually you can have good conversations and at least know where they stand. Next slide. And yes, I think Applebee's has now gone smoke free. This was years ago. that this happened. But I don't think that they allow smoking anymore, which is great. But it was funny years ago when we went in there and they were like, you asked, I was like, do you guys allow smoking? They were like, only in our bar area. Where is the bar area? In the middle of the restaurant. So you're like, but there's people sitting all around. So, anyways, times are changing, thankfully, but it was just interesting. So what you're here, these are some of the tactics and arguments that you're here. So be prepared on having answers for this. And again, this is nothing new. You can find these arguments, you can find tactics to kind of push against it. But be proactive on addressing these concerns and dispelling any of these myths. There are some of these things that you may hear, but have responses or sample stories. Always mention that there's just no safe level exposure to secondhand smoke. Why is it okay for some people to be protected and some not? The change jobs ones is one I've always heard a lot. And I used to give an example because I was locally from a casino. I was from a casino city, and that was the big economy from where I'm from. And I would give an example, well, if you have a woman there who becomes pregnant while she's working, this is not the time for her to give up her job. She has benefits, she may be able to have her time off when the baby comes. Starting a new job when you're pregnant is very difficult, just going through it myself. So those are things to think about, and people might really like the work they do. They may enjoy being a dealer or a bartender and they don't want to give up their job. But why don't they deserve the right to have smoke-free air and a clean, healthy environment to breathe in? So having these examples, you're going to see different arguments though in every different community. But just again, come with your messaging, just be prepared for these things. And again, I kind of highlighted some of the biggest pushbacks that you're going to see. And finding good champions. Next slide. If you aren't able to have a community, with a city council or alderman, this is when you lean on allies, volunteers, or supporters with your community. Sometimes you can find champions like a mayor or a city council member, but sometimes you do have to use somebody who's just a part of the community, a business owner, or just a mover and shaker. But these people can set up meetings and have calls with the local council, the local board. They can go and speak on behalf of this campaign. But these were just some of the quotes that we've gotten over the years from different champions in different areas of the nation. And you will find that some have it hard. Some have been touched by the tobacco. What am I trying to say? They've been touched by tobacco because it's hurt a family member. They've been touched by cancer, or they're just overall want the best for their community. So they're willing to put their neck out on the line and kind of speak up on something like this. So you'll find people, you'll be surprised what people can be passionate about and how this is important to them. But make sure that this individual is accurately communicating with the goals of your coalition or and your deal breakers. Are there certain exemptions, hours, provisions, grandfather clauses? Make sure that you're on the same page with your champion if they are holding these meetings and doing these presentations, and that you guys see eye to eye on what you're doing. All right, next slide. So I wanted to highlight some great facts. Again, ACS CAN has some great handouts on this that you can find on the fightcancer.org that I always promote. Smoke-free policies are good for business. I mean, there's been tons of research that's been done, and it shows that it doesn't negatively impact the economy. It shows that smoke-free laws had either a positive or no effect on restaurants' revenue and other economic indicators, such as the number of employees. A study of restaurants and bars in Missouri cities found that 8 of the cities experienced increase in sales after a local smoke-free ordinance was implemented, and the other 3 didn't experience any decline. And the same goes with bars. Data has supported studies in these 9 states, including Texas and Florida, all of which reported no effect or an increase in bar revenue and employment following passage of smoke-free laws. Again, coming from a gaming industry, the few casinos that have gone smoke-free have increased their employees, and they have increased their gaming tables. And they promote it very loudly wherever it is that they are a smoke-free facility because they know that they will get those customers. So the proof is there, and it's easy to find now because, again, this isn't anything new and it's been around for decades. Next
I think
slide.
I think Tara, well, Tara, I think she jumped past the business slide. Go back one. Yeah.
Oh,
Oh,
oops, I must have
yeah. So,
clicked twice on accident. Sorry, Kelly.
okay, I didn't even notice. I thought we were still on there. So this,
Yeah.
yeah, this is just highlighting that it doesn't reduce tourism. It
Yeah.
saves businesses money, and it does save. I've known, we all know that smoking indoors too, that those chemicals settle into carpets, cloth. I've known restaurants that decided to go smoke free, but then they kind of had to redo some of their decor because it smelled like smoke. We've seen this in hotels, why more and more hotels don't want to do it, or in apartment complexes because that smoky smell is really hard to get out without pulling up carpet, getting rid of curtains and things like that. So they have found that it's just cheaper to stick with being smoke free. So highlighting the health part, of course, this is going to be very important to me and to the work we do in public health, of course, in reducing cancer risk. But the evidence shows that implementing smoke-free policies has immediate benefits for restaurant and bar workers on health. And I think sometimes we think about the consumer more than we do about the actual employee who is working in this environment 8 hours a day, 5 days a week. But the Surgeon General reports has listed that in high-risk settings such as bars, smoke-free policies can lead to reductions of 80 to 90% of secondhand smoke exposure. So this exposure is an occupational hazard for many workers, including casinos, restaurants, bars, hotel employees. And it can be preventable cause of death and disease for them. So, even the expense of insurance costs for that employer, we've said that too. I think that's why some have changed as well, right? You get healthier employees, that means less insurance costs from the company side. So no one should have to choose between their livelihood and their health. And there has been research, I think we've talked to probably on this on another call, around smoke-free laws reducing hospital admissions for cardiac and respiratory events. I know that there have been a lot of research in cities that have passed it that have shown that you just overall those things drop when you have a smoke-free community. All right, so next one. So these are just the keys to moving forward. Do you know what your community looks like around smoke free? Is there support? Is this the business community? Be able to speak to opposition arguments, and do you have the votes? Again, you can use your allies, you can use your champion to have these conversations for you. You don't have to be the one having that conversation if you're not able to. Again, I am not, but we use volunteers to have these conversations, and they like to hear from their constituents, right? They like to hear from local people who find this important. So if it's not there and there's not the vote, then it's usually a good idea to wait, right? You don't want to bring it up. You don't want to lose out on that opportunity. So usually you fall back onto more education, more outreach, and gathering more allies. The change can come in months, but also can be years. Sadly, I have worked on a community. It can go back to like the early 2000s where there's an article released. One of my champions was quoted on trying to pass smoke free, and this city has still not passed it. It's just changed over the years. We've tried all kinds of different tactics, but you'll see that. But then you have other communities that pass it within months. So it just really depends on, who's leading, who do you have as your champions, and a lot of different factors. So don't give up hope. Just know that this work is important and that day can come. I wanted to highlight some of our partners and just great people, great organizations that you can use for tools and resources. Like I mentioned earlier, of course, the Department of Public Health here in South Carolina, they have some great information around it. I have to, of course, mention our partner group, the American Cancer Society Cancer Action Network. Beth and her group have a lot of great information, but there's so much information, there's research, enough to make you feel like you can do this and that you have the support and education that you need to face any opposition. And then quickly, I wanted to just make sure I talked about integrating tobacco cessation with your ordinance campaign. I think that's key. If your community goes smoke free, well, there's usually going to be people looking to quit using tobacco. So are those resources available and what is out there? So when doing the outreach for passing a smoke free ordinance and even after a policy is passed, providing the community tobacco cessation information is just so important. So I wanted to touch on some of these things. And I put a quick quote on the next slide, just that quitting smoking considerably reduces health risks. It just is so important and one of the best things you can do for your body. Next slide. So why does tobacco cessation matter? So smoke-free laws often motivate tobacco users to quit. So providing cessation resources shows compassion and just helps build that public support. Of course, quitting tobacco reduces risk of heart disease, stroke, COPD, and cancer. And it just improves outcomes for those who've already been diagnosed. Cessation programs tailored to underserved populations, they do help to address the inequities in tobacco disease and death. And smoke-free policies are often more effective when paired with cessation support, increasing compliance and reducing oppositions. I know that like we've worked with chambers before who will then supply cessation quit line cards or resources within their community. They'll do an outreach, maybe a community health event after it passes to make sure people are aware. They've run ads. Just showing like, hey, if you need to quit, if this is going to interfere with your work or your life, there's opportunities and there's resources for you. So combining smoke-free laws with cessation programs and can also prevent youth initiation. Research has shown that cities or communities that have a smoke-free ordinance usually have less youth who initiate tobacco use. So that's another positive. And then next slide. I wanted to promote our quit line. Again, I work in many states and we are very lucky to have the coverage that we have here. The South Carolina Tobacco Quit Line is free, it's confidential, service available to all South Carolinians age 13 and older who want to quit smoking, vaping, or any other nicotine product. I think that's another confusion. Sometimes people think you have to be a smoker to use the quit line, but it's vaping, it's chewing tobacco, it's anything. It's an addiction to that nicotine. So if you need to help somebody to some service to help you quit, this can help. So it operates 24/7. I know it's closed on a few major holidays. It offers support in Spanish and English, and services are available regardless of readiness to quit. So whether you're just thinking about it or you're actively trying, they can help you with this. So enrollment can also include non-prescription quit medicines like NRT, the nicotine replacement therapy. That's of course available for 18 and older. But providers providers play a critical role in initiating these quit attempts. So I know from my end, our ACS staff, we work really hard with our clinics and healthcare facilities to help promote the quit line or cessation services when they are talking to patients who are using. And they do have provider referrals by fax or online. I can share these slides after this and these links work and will take you there. I did a quick screenshot of what a referral looks like by fax. So they try to keep it really easy. And patients are more likely to succeed when referred to the quit line and supported with medication and counseling. That has been proven. And I'm gonna my next slide, because I think one of the biggest things that we have sometimes, oh, I'm sorry, I'm not there yet, but I'm gonna get there, is providers being educated on talking about cessation. Providers know that tobacco and the dangers of it, but sometimes having those conversations can be really hard. And there is language that can be used that motivates more than some language. So I'll get to that. But I wanted to highlight too, using important dates throughout the year is highly critical to promoting cessation. So using these awareness dates, host community events at clinics, have webinars, storytelling sessions, share these success stories, distribute toolkits and resources tailored to your population. And, so it can be really important. I wanted to highlight Great American Smokeout as our next big event that's coming up around tobacco cessation. You can use lung awareness events to help promote it, but it shouldn't be just one day a year that we're talking about quitting. It should be multiple days of year. It should be ingrained within our workforces, within our communities, and getting people to quit. And I just put some other appropriate messaging. Make sure you're using, stories that resonate with your community, using empowering language, not stigmatizing language, instead of using a person who smokes instead of a smoker or an addict or a tobacco user. Behavior is a changeable and treatable, and not behavior as a defining character of that person. So just using appropriate language. And then I wanted to highlight Great American Smokeout because it's coming up. Of course, cancer.org. We have lots of resources, free printouts, lots of different education materials that you can use on the day of the event. I think it's going to be November 20th of this year. It's usually the third Thursday. We will celebrate 50 years next year of the Great American Smokeout. So I know we'll really try to make next year a big year, but I think every year should be a day that we use this opportunity to educate and get resources out within our work sites or community. And again, I can share these links after the follow-up. And then the partner with local providers. One more slide, Tara, and community organizations. So collaborating with clinics, hospitals, and your grassroots group to expand access to tobacco cessation services. These partnerships can really help deliver culturally relevant support and increase community trust, but also ensure that cessation resources are available where people live, work, and gather. South Carolina is unique in offering free trainings to provider physicians with the tools to discuss cessation and how to implement brief tobacco intervention into their clinical work. So I highlighted that and some contact information. That's really awesome that this this is offered in South Carolina. Again, I don't see this everywhere. So if you work with a healthcare facility and this is something you're interested in, please use these resources as a way to help um, make your providers feel more comfortable about having these conversations, and not just kind of checking it off whenever they're doing that intake, but really having these discussions of why it's important that they quit, and empowering their patients to make that decision. All right. I think that's it. I put some, the next few slides are just kind of some of the places that I got some of this information. But I know we're running out of time. My apologies. I just, really passionate about this. Does anybody have any questions, any information or anything that I missed that you would like to share?
Well, Kelly, have you worked with North Charleston area at all, doing any education? Because I know that's a large population of people who are not protected. The workforce is not protected by smoke-free. Have you done any work in that location?
I haven't. I don't have any good contacts really there right now, but I am more than happy to partner or, use our resources to help educate. Kind of why I'm on this call was just to empower this group and others to share this information and how we can continue disseminating, to make it bigger, and the importance of it. But I haven't. But
Yeah.
that's a great idea, Dr. Keeley, and I'm happy to
Yeah.
connect with someone down there.
So
I
Dr.
just,
Keeley,
oops,
the
sorry.
Charleston has been on our kind of side target list for a little while. So I know that some partners have been having conversations about that community.
Yeah, I think there's a new mayor, and there were some hopes that that change, would open the door for some more discussions. So I actually met someone who's on the or has a close friend on the North Charleston City Council. So I maybe can check back with that person and see maybe you might want to contact them. Yeah. And as Tara just put in the chat, you could talk with Breathe Easy SC and Smoke Free Low Country about what they've been up to. But with the energy that you delivered in this wonderful presentation, I think they might really welcome your energy and whatever assistance you can provide. Yeah.
Great. Yeah. I love that. And again, my work, Beth is the leader of the advocacy, but I am the leader of, I hope, the education and resources and the connections. And I'm happy to work with any community on, giving ideas and thoughts of how to do that outreach and just sharing the services. I think South Carolina has a lot of great things that it's offered and resources that unfortunately I don't know that people are aware of, but limited people, right? We're all, public health is, sadly, it's just not enough people to do all the work that's needed. So, but thankful for you guys and for listening. I know that was a lot of information,
Yeah.
so I appreciate you guys for having me and letting me share. And feel free to contact, I'll send out these slides, and if I can be of any help, feel free to reach out. Um, I would love to help out.
One other thing folks might be interested in, when we did our smoke-free indoor workplace uh, ordinances here in York County, we had a meeting with the local hospitality industry business group, and we had a panel, and it was really helpful. These owners of hospitality sites, at that point, were really worried about lost revenue and things like that. So to have an educational session coordinated with the local hospitality association group, is something that maybe North Charleston might want to consider. The other thing that we heard was that workers, if I'm on a team of people working in a restaurant or a bar, and one of my coworkers is a smoker, then they'll take smoke breaks. And they the non-smoking employee said that it was unfair. They didn't get extra break time. But the smokers, they just went out and took their smoke breaks, and it would frustrate the other staff. So sometimes you get those stories from the employees, how how stress,
Yeah.
stressful it is. Yeah.
I know. And then I think that's where it comes in of doing that employer education too. I think some larger employers have become more apt on health and wellness and providing resources to their employees. But I think some of these smaller ones like restaurants and bars don't always know where to start. But maybe that's in where employer steps in and says, hey, there are resources to help people quit smoking, and just sharing and, empowering their employees to, make these changes just for their overall health and wellness of who they are.
Any other questions or comments for Kellie? Okay. So thank you again, Kellie, for joining us. We record the presentations, we post them on our website the following week. So if you just go to smokefreesc.org, there's a tab that's called Tobacco Free Partners Roundtable, and all of the recordings are there. And if Kellie's able to share her full slides with us, we will link the slides on the presentation recording. You just have to click on the title of the presentation, and you can access those slides there. I know we're a little past time, but does anyone have any updates or acknowledgements or things like that they would like to share from their respective areas or organizations? All right, then. Well, I hope you guys have a great rest of your Friday and a great weekend. Our next roundtable meeting is going to be on October, the 24th. It's always the fourth Friday of the month. And we have Jaron King. Jaron's a former Department of Public Health worker here in South Carolina, who now works for the CDC Foundation doing tobacco work there. So we're excited to have him present to us next month. So if you haven't already registered for next month's meeting, we would love for you to do that. And we hope to see you all next month in October. Thank you again, Kelly. Great information shared. Thanks, everyone.
One quick thing, Kelly,
Oh.
check the chat before you sign off, because a couple of people have said that they can help with the North Charleston area, in the Charleston area, in the
Okay,
chat.
yeah. I'm
Yeah,
slowly
Kennedy
copying
works
and
at
taking
the.
notes.
Yeah.
Awesome.
All right.
Great.
Thanks. Yep.
All right,
Thank
bye,
you.
everyone.
Hi.
I'm sticking on for a minute to grab some of this.
Yeah. Tell me when you're
Sorry.
ready. I won't end it until you tell me to. And I can also send the chat transcript to you if you need me
Yeah.
to.
Oh, that's true. Here, I think I've almost got it.
Sorry, I messed up on the slides every now and then. I thought that one time, Dr. Keeley, it looked like 2 slides went by, but I was like, maybe it was just in my head. And I think
Yeah. No.
I double
Yep.
tapped and didn't mean to.
No, that's all right. Kelly kept going. That was what was important.
Yes, yes. Information was still shared.
Yeah.
Okay. All right, I got it.
Did you get it?
All
Yeah.
All
righty.
right. All right.
Awesome.
Thanks,
Thank you,
Kelly.
y'all.
guys.
Yeah.
Have a
All
good
Bye.
weekend.
You too.
Bye.
Bye.
Bye-bye.